Student LPN, and today I'll be reading a summary of urinary and reproductive systems from Cemeq Module 16. And this is the book right here. Okay, so the urinary structure system. The urinary has 2 kidneys, 2 ureters, the bladder, and the urethra. The kidneys are responsible for filtering blood, producing urine, and maintaining body's fluid balance. The kidneys eliminate substances that are not reused by the body, as well as toxins such as excess water. The kidneys also help balance pH, activate vitamin D, and maintain blood volume that produce renin and erythropoietin. Then we have the ureters. The ureters deliver urine from the renal pelvis, and urine is passed through the ureters by peristalsis. The urinary bladder. The urinary bladder receives urine from the ureters and it contains it until it's ready to be released. The urethra. The urethra allows urine to pass through the body. In males, it also helps semen pass. The characteristics of urine. Okay, so volume. It's about 1 to 2 liters every 24 hours. The odor is slightly odorous, becomes ammonia-like when left to sit. The color is a yellow amber due to the pigment called urchrome. pH levels are between 4.6 to 6.0, regular urine levels. Okay, so the substances found in urine, and excuse me if I don't pronounce them right. Normal substances are electrolytes, phosphates, nitrogen, urea, uric acid, creatine, ammonia, fatty acids, pigment, hormone. And then we have things that are abnormal, such as albumin or glucose, red blood cells, white blood cells, excessive quantities of bilirubin, urinary cas microorbs. Factors influencing urinary secretion, such as high blood pressure, reduced blood pressure, increased blood secretion, such as hemorrhage or hypothermia, factors increasing urinary secretion, factors decreasing urinary secretion. We have also drinking excessive amounts of coffee, alcohol consumption, physical activity, hydration, and diet. And we have voiding reflex. Voiding reflex is the voluntary and involuntary, unconscious and conscious need to urinate. Then we have the anatomy and psychology of reproductive organs. Reproductive organs have obvious differences, however, you may not notice they have a lot of similarities. The female reproductive system consists of internal organs such as 2 ovaries, 2 fallopian tubes, the uterus, the vagina. The external organs such as the vulva and the breasts. Ovaries are equivalent to the male's testes, and each one has filament which admits blood vessel nerves. The ovary is a both endocrine and an exocrine gland, which we call a mixed gland. The role is to produce a hormone called estrogen, progesterone, inhibin, relaxin, as well as secondary oocytes. Then we have the fallopian tubes, which serve to transport the secondary oocyte to be fertilized into the ovum to the uterus. And the encounter between the ovum and the sperm usually takes place in the ampulla of the fallopian tube. The uterus is a hollow organ and a muscular structure that assists reproductive function, and its shape and anatomy vary on different stages of life and also during pregnancy. The uterus's role is to allow implantation of the fertilized ovum and to host the fetus during development and expel the fetus during childbirth. When fertilization does not occur, this is when we have our menstruation. Then we have the vagina. The vagina is a cavity extending the cervix to the exterior of the body. The vagina is slightly acidic, pH of 5 to 4, and overly acidic pH can harm the sperm. Then we have the mammary glands, which are known as the modified sweat glands. These are in our breasts. The size of the breast is determined on the volume of adipose tissue. Each lobe is composed of connective tissue divided in multiple small compartments called lobules, which contain clusters of small chambers called alveoli. Alveoli secrete milk into the interlobular ducts. These continue lactation ducts, ending in the nipples. So the function of the mammary glands overall is secreting milk under the influence of prolactin and releasing milk under the influence of oxytocin. Then the reproductive menstrual cycle, which I'm just going to list the phases for now. If you want me to make a video on each specific phase, let me know. We have the menstrual phase, the follicular phase, the ovulatory phase, and luteal phase. So once again, just to recap, you have to know the hormones that are in the ovaries, which are the estrogen, progesterone, relaxin, and inhibin. Those are the main ones you need to remember. Okay, so the male reproductive system. We have the scrotum, which is support of the testes and divided into two compartments by perotin called the scrotal septum. Okay, the location of the scrotum and the contraction of its muscle fibers allows the temperature of the testes to be regulated, and the testes need to be cooler than body temperature to create and sustain sperm. This is why this organ is outside of their body instead of inside. The testes are located in the scrotum. What you need to know is that they produce sperm. After being produced, spermatoza is transported through and convoluted symphysis tubes to a network of canals spread through the testes known as the ret testes. From there, they enter the sublingual tract. The urethra is the final passage, and it serves as a passage for semen and urine. Then we have the accessory glands, such as the sublingual vessels, the prostate, and the bulbourethral glands. Sorry, I can't pronounce it. And then we have the penis, which is a male compensatory organ. So the psychology of the male reproductive system, we can say that it changes over life. Around the age 50, testosterone falls and diminishes muscular strength and a decreased number of visual sperm. But however, the sperm does stay high, and around 60, around a third of males experience increased prostate volume. So the psychology of sexual relations depends on different phases, and like I said, if you want me to get more in detail, let me know, but I'm going to just go very basic right now. The four phases are excitement phase, the plateau phase, the orgasmic phase, and the resolution phase. And these are just different parts. Okay, and then we have factors affecting sexual response, such as disturbance of body integrity, or disruption of body image, disrupted self-esteem, emotional conflict, fear and resulting earlier trauma, lack of knowledge of contraception and not knowing how to protect yourself against STDs, and lack of privacy. Factors affecting reproductive function is integrity of the endocrine system, integrity of the cardiovascular system, integrity of the nervous system, and hereditary. System. Okay, excuse me if I cannot pronounce this word. I do not know why I cannot. Glomerulitis is a result in streptococcus infection or of an antigen-antibody reaction caused by certain autoimmune disease. Signs and symptoms are mild and severe hypertension, headaches, dizziness, ekphasis, more or less generalized edema, urinary problems such as oliguria or nocturia, changes in urinary composition, so like hematuria, which is blood in the urine, dark colored urine, increased kalemia, keratemia, zomia, fatigue, and anemia. Grayish yellowish skin tone, pruritus, confusion and convulsions, digestive problems, weight loss. Treatment: observe bed rest in case of acute disorder. Administer prescribed medications such as hypertensives, diuretics, corticosteroids if chronic, and antibiotics. Provide a diet that is low in protein, low in sodium and potassium. Increase carbohydrate intake, and follow prescribed fluid restrictions. Accurately calculate fluid balance, record weight every day as prescribed, and proper skincare. So take care of kidney or renal failure. Okay, so then we have renal failure, also known as kidney failure, is a sudden or nearly acute kidney failure is a sudden or nearly total loss of kidney function caused by the breakdown of renal circulation, all conditions causing a drop in blood pressure or hypovolemia. Okay, so then we have chronic renal failure, also known as chronic kidney failure, is a progressive deterioration of renal function due to glopharitis, the one I couldn't say that we were just talking about, uncontrolled high blood pressure, hereditary damage, or elimination of excessive quantity of toxic substances. Signs and symptoms are similar of kidney failure are similar to those of glopharitis, the one I can't say, varying on intensity. So signs and symptoms in general are profound lethargy, drowsiness, convulsions, muscular contractions, progressive towards coma. Patient tastes maybe a metallic taste in their mouth. Skin may be covered with a white powder. Patient maybe have hyperventilation or breathing problems. Treatment is the same as what we were talking about in the previous disorder. Okay, another one that I can't pronounce. Pyelonephritis. Section of the renal pelvis and the tubular intestinal tissue in the kidney. So this is inside of the kidney that's being hurt. Okay, so signs and symptoms of acute are chills, hyperthermia, lateral pain, convial tenderness, polyarchia, and dysarchia. Then we have chronic, which is polyuria, excessive thirst, chronic fatigue, loss of weight, and loss of appetite. Treatment is administer prescribed medications such as analgesics if necessary, antimicrobials, perform urine cultures.